5,000 to.
Yan.
One, two, three. Oh, okay.
Sino ka niya, ma? Be careful, it's slippery. Be careful. Opening.
You're not gonna pass.
Relate.
Wala ka naman ng wasalamin sa'yo.
Ito yung ID ko. Tsaka yun. Hello?
Luma, tulungan mo ko. Tulungan mo ko.
Next, please.
Drug types. First is stimulants. Example of stimulants are caffeine and nicotine. The effects of stimulants are increase of alertness. Sedatives. Example of sedatives are alcohol and tranquilizers. The effects of sedatives are CNS slowed. Painkillers. Example of painkillers are aspirin and morphine. The effects of painkillers are suppress pain receptors and neurons in CNS. Hallucinogens. The example of hallucinogens are LSD and cannabis. The effects of hallucinogens are feeling of enormous energy and hallucinations. Alcohol. The example of alcohol are alcoholic drinks, and its effects of alcohol are lowers inhibitations, slowed CNS, and reaction times. And the last one is solvents. Example of solvents are glue, paint, and fuel. The effects of solvents are distorted perception and hallucinations.
So the penalty and treatment of drugs. So first is the treatment of drugs. So drug dependence is considered a multifactorial health disorders that often follows the course of a relapsing and remitting chronic disease. So given the individual and social economic burden inflicted by drug dependence, the effective treatment and rehabilitation of patients of significant public health importance, the global health approaches in drug dependence treatment and care have been the springboard of existing good practices and remaining the most fertile ground for the development of innovative and effective responses. So, the best results are achieved when a comprehensive multidisciplinary approach, which includes diversified pharmacological intervention, is available to respond to the different needs of the patient. And even taking into account the requirements of the delivery of the evidence based on treatment, it costs much lower than the indirect cost by untreated drug dependence like prison, unemployment, law enforcement, and health consequences. So next is the penalty of drugs. So according to Republic Act 9165, Section 16, the possession, use of regulated drugs, the penalty of imprisonment ranging from 6 months and 1 day to 4 years, and a fine ranging from 600 to 4,000 pesos shall impose upon any person who shall possess or use any regulated drugs without the corresponding license or prescriptions. So, a person apprehended or arrested who is found to be positive for use of any dangerous drugs after a confirmatory test shall be imposed a penalty of minimum of 6 months rehabilitation in a government center. For the first offense, if apprehended using any dangerous drugs for the second time, he or she shall suffer.
Think about your future. Don't let drugs ruin your life. Say no to drugs. Change is coming.